My name's Kimberly Hardy. I go by Kim. I am in the 4th year of the nursing program. I started the program here with the LPN course, and then so it was just always my goal to do the RN program. I started with the Athabasca route, so I took a couple classes with that. And, I had a young family, so it was just harder to kind of finish a course. It would take me the whole 6 months to finish a course. And then when this came up, it was like, okay, I'm gonna jump at this opportunity to, enroll and I find it's because we're a smaller group, we're able to kind of just, I guess, get into more detail of things where it's not just a really big group where you're kind of just taking notes and everything. It's a bit more hands-on, I find, and then because we're a smaller group, we're able to kind of work together and help each other out, I guess. I guess they would have that in the city too, but I think it's just, I think the sense of home, being with like people who are First Nation as well, or Métis and First Nation, it just kind of helps the study group. I think it worked really well for me, just because I have a really big family, right? Like I have 4 kids and my husband, we have 2 dogs, 2 cats, so we have a big family. And it was just easier to be able to log in from home and join my classes and then come here and then do our labs and everything. It was like, for me, it's like a 5-minute drive. The incorporation of the culture and the elders in the program I thought was really, really good. Kind of grounded me. I guess when the elders did come and speak and they talked about like histories and all that stuff, and it just kind of grounded me because it's something that I grew up with, and it just kind of helped me incorporate that into my nursing studies and I guess who I want to be as a nurse and stuff. And this past semester, it really helped me kind of like with my Indigenous, I guess, identity. It reminded me like what type of nurse I wanted to be, my nursing philosophy, like what kind of teacher I want to be as a nurse. Like I kind of went back to like, I guess the teachings I've grown up with and then implemented them into my nursing philosophy and my teachings and all that stuff. So yeah, I think the clinical experience was, I guess, the most valuable part, because a lot of First Nations are hands-on learners, and then same for me as well. Like I'm a hands-on learner, so I have to do it in order to learn, I guess. So I think the clinical part of it was really good. It was only like 2 days out of the week, so the Thursday and Friday. And we kind of alternate between day shift and evening shift. I thought it was really good because, yeah, you get a lot of learning experience through that. Every semester, clinical is different. So you learn, like, I guess, daily care in the beginning. You learn vital signs, daily care in the beginning. And then the second one, you learn kind of like the medication part of it. And then same with the second, you do a lot of like wound care and all that stuff. And then the last semester is kind of just putting it all together. So looking at the bigger picture of the patient. So there's the meds, there's the, like say there's dressing changes, and I guess just learning to manage care with 4 or 5 patients, and then looking at the bigger part of it. I know I still have a lot to kind of learn, but I think this next semester will help as well, kind of put everything together. So for the UFC simulation labs, they're all pretty much different. Like every lab was different. So with the first one, we had like I think it was a blood sugar patient who was like declining, and it was just like we'd all get put into like groups, so 2 or 3 groups, and then we kind of go in. I think these simulation labs are really good because they give you a chance to learn, make mistakes and learn. And then they also what's that word? Utilize, I guess, your skills in that setting. So how it works is we go into a room. I'll just use the second simulation as an example. Our patient was coding, and so our patient was on the bed, and then we're being watched from a glass, and then we're kind of, I guess, what your steps would be into taking care of this patient. And then, and Yeah, and our patient's coding. So you're doing CPR in there and you're getting like calling the charge nurse and everything. And I think it's a really good experience to kind of make mistakes and learn from. And it's just like 15 minutes, like we get 15 minutes, but they just go like quick and it's like, oh, we're done. And they tell us kind of like what we can improve on, what we did really well and everything. And it's just, yeah, I think it's just a really good learning experience. So the future of nursing for me, one of my goals was, like I said, as an LPN, just to get my RN to be able to provide more care to the community here in Siksika. But I still want to be like work in the hospitals and do bedside nursing just so that I can keep my skills and get experience and then be able to come back to the nation and I guess help out a bit more, take care of my people. One of the things my grandparents told me was you get educated, you work, get experience, and then you come back and you take care of your people so you can, thrive together. So, yeah. Yeah, I think if you're getting into nursing, I think it's a really, really good program to get into, especially as a First Nation woman. It's it's when you're in the hospital and you see like someone who's First Nation, a First Nation nurse, you feel more comfortable, and I feel like we need more First Nations in that setting. And then same with in the community as well. Like we need people who we can look up to, or you can be like a someone who advocates for our people and someone who like what's that word I'm looking for? It's just someone to look up to. And yeah, and then for me, just like as a First Nation woman, a First Nation mom, um, as I get older, I would love to see someone younger First Nation taking care of me.